morning. I'd like to call the public hearing of the House Children and Youth Committee to order. Just a reminder that this hearing is being recorded, so please make sure your phones are silenced, and members, please make sure your mics are turned on when you speak. We'll begin with committee member introductions. If everyone could share your name and legislative district. I'm State Representative Jeannie McNeil from Lehigh County.
Good morning. I am State Representative Kate Klunk. I represent the 169th District in the southwestern portion of York County. I would love to welcome our testifiers this morning. Looking forward to hearing more information about House Bill 460. This bill was in the Education Committee last session, so this is the first time we've had a chance to look at it, but look forward to hearing more. Thank you.
Good morning and welcome. My name is State Representative Darisha Parker of the 198th District in Philadelphia.
Hi, I'm Nancy Ganis. I represent the 152nd District in Montgomery County.
Thank you, everyone. The purpose of today's hearing is to discuss House Bill 460, sponsored by Representative Mary Jo Daley. House Bill 460 would require school districts to adopt age-appropriate curriculums on child abuse. Chair Klunk, would you like to offer any opening remarks on this? Okay, thank you. Our testifiers today will be Abby Newman, Chief Executive Officer, External, and Global Affairs, Mission Kids Child Advocacy Center; Robert Manzi, Esquire, District Attorney of Indiana County; Kelly Callahan, Esquire, Executive Director, Pennsylvania District Attorneys Association; Benjamin Levi, MD, PhD, Professor, Departments of Humanities and Pediatrics, Penn State College of Medicine; and we will be joined by Representative Mary Jo Daley, prime sponsor of HB 460. Thank you all for joining us today. Members, please hold your questions until the end. Once the testifiers have finished, we'll open the floor for questions. Finally, we will conclude with closing remarks from Representative Daley. Ms. Newman, would you like to start?
Yes, thank you. Can you hear me okay? I don't know how this...
Yes.
Okay, great. Good morning, Majority Chair McNeil, Minority Chair Klunk, and members of the House Children and Youth Committee. My name is Abby Newman, and I'm the CEO of External and Global Affairs at Mission Kids Child Advocacy Center in Montgomery County, and I'm also a member of the Board of Directors of the Pennsylvania chapter of Child Advocacy Centers. Thank you for the opportunity to speak in support of the proposed legislation requiring schools to provide age-appropriate child abuse prevention education. I'd also like to thank Representative Daley for sponsoring this critical bill, which reflects a long overdue commitment to safeguarding children. However, we must ensure implementation is grounded in best practices and led by trained experts, not placed on the shoulders of educators who are untrained in child abuse prevention programs. Child sexual abuse remains a critical issue in Pennsylvania. The state's 40 child advocacy centers, and I might refer to them as CACs, serve 15,000 children annually, which is a significant number of those cases are sexual abuse cases. In Montgomery County alone, Mission Kids handles 600 new cases a year, of which over 400 are sexual abuse cases. And we've handled more than 5,000 sexual abuse cases since 2009. Mission Kids is fully accredited with the National Children's Alliance, including in prevention education. We deliver evidence-based and evidence-informed programs to 14 of the county's 26 school districts, and we've trained 60,000 children, grades K through 12, since 2022, using the established programs that are listed on the attached sheet. Nationally, 1 in 10 children experience sexual abuse, though many cases go unreported due to fear, shame, or lack of awareness. A 2025 study found that when including online sexual abuse, such as grooming, image sharing, and commercial exploitation, the prevalence rate rises to 22%. Untreated child sexual abuse has lifelong effects: PTSD, depression, anxiety, substance abuse, and difficulty forming healthy relationships. It also increases the risk of physical health problems like heart disease, obesity, and diabetes. Survivors are more vulnerable to commercial sexual exploitation, which is also called human trafficking. Early intervention is critical to reducing these outcomes and promoting healing, making prevention education a long overdue necessity. School-based prevention programs work by raising awareness about what sexual abuse is, that the swimsuit area should be protected, that you can tell a safe adult if someone is violating you, and it's okay to say no when confronted with inappropriate or uncomfortable touching, and that sexual abuse is never your fault. An analysis of data of more than 11,000 students found significant increases in abuse knowledge, and protective behavior, when programs were age-appropriate, repeated over time, and led by trained professionals. Effective evidence-based curricula must be grounded in strong research and validated interventions, or at least evidence-informed, integrating research with professional judgment, lived experience, and client voices. DHS, DPW, and the Department of Education are not experts in creating these specialized curriculums and should instead recommend use of developed evidence-based and informed programs. Expecting educators to independently create and deliver this programming is unrealistic and risky, as teachers lack specialized training to handle these complex and sensitive topics. Program delivery must be supported by CACs, licensed clinicians, and professionals with expertise in child abuse dynamics and trauma-informed practice. Without this foundation, well-meaning efforts risk doing more harm than good and overwhelming school staff. Allergies. Following the 2012 Jerry Sandusky child abuse sex scandal, Dr. Jenny Knoll and her team at Penn State University were awarded a grant from PCCD with Endowment Act funds to develop and help implement the Safe and Healthy Communities programs in 5 counties in Pennsylvania. This unique program was a coordinated effort that used evidence-based programs to educate parents, adults across the community, and children within the schools. This effort was recently published in a high-impact peer-reviewed scientific journal, JAMA, for those of you who might be familiar. And it was the first ever program to actually change rates of sexual abuse at the population level. Over the 3 years that it was in place, nearly 120 children were spared sexual abuse. The most effective component of that intervention was the 1-hour program at the schools, where it reached over 14,000 second graders. Within this program, Pennsylvania has already developed and become a leader with a cost and time-effective evidence-based prevention program, and so there is no need to spend additional time and funds to reinvent this particular wheel, but it is necessary. Delivery of safe and healthy communities costs an average of $43 per student. Mission Kids, we have delivered this program, and through operational efficiency and scale, we've been able to reduce this cost to $25 per student. I would opine that this is a very small investment when compared to the emotional and financial toll of child sex abuse on individuals, families, and society. Legislation must also include provisions for children outside traditional school systems. Research indicates that homeschooled children, particularly in isolated or unregulated environments, may face heightened risk for undetected abuse. These children must also be protected through access to community-based programs or mandated participation in prevention efforts through umbrella school structures. In closing, this legislation represents a powerful opportunity to protect Pennsylvania's children before abuse occurs by grounding implementation in evidence-based practices and leveraging the expertise of child advocacy professionals. We can ensure that every child has access to the knowledge, support, and protection that they deserve. Thank you very much.
Thank you for your testimony. And now we'll hear from Robert Manzi and Kelly Callahan.
Thank you and good morning. I want to start off with, if my voice gets a little rough or a little low, please kind of let me know that you can hear me. I had the pleasure of spending 3.5 hours watching our local high school team go to 12 innings of state championship baseball, and fortunately our starting catcher, Ethan Shank, was able to hit the RBI single walk-off in the bottom of the 12th to send us to the next round. But in those 3.5 hours, I might have used my voice a little more than normal. Thank you. Thank you. We're fortunate to have good baseball in Indiana County. Homer City went to the second round themselves, so hopefully my voice will be back for Thursday when we face our next opponent. Good morning, Chairwomen, Representatives McNeil and Klunk, and all of the members of the House Children and Youth Committee. Thank you for inviting me to participate in this hearing focusing on the importance of age-appropriate child abuse awareness and education programs for K-12 school students and a need for ongoing training for mandated reporters working within the school settings. Thank you for giving me the opportunity to offer remarks on behalf of the Pennsylvania District Attorneys Association today in support of House Bill 460. My name is Bob Manzi. I am currently the District Attorney of Indiana County. I've spent much of my legal career as a prosecutor. Prior to becoming the Indiana County District Attorney, I was a certified legal intern at the Chester County District Attorney's Office, an assistant district attorney in both Bucks County and then Delaware County before moving west. I currently serve on the Pennsylvania Mental Health and Justice Advisory Council and participate in our county child death review team established pursuant to Act 87 of 2008. I currently sit on the Pennsylvania District Attorneys Association Executive Committee and work closely with the PDAA Executive Director Kelly Callahan and my colleagues serving across the state on issues of child abuse, neglect, and exploitation to address best practices for protecting children throughout the Commonwealth. Prosecutors embrace the multidisciplinary investigative team approach and work with law enforcement, child advocacy centers, victim advocates, children and youth caseworkers, behavioral health, and medical professionals to collaboratively respond to child neglect, exploitation, physical, and sexual abuse. Collaboration in the form of MDITs created a more efficient investigative process, which can lead to successful prosecutions. Most importantly, this approach is victim-centered and places great emphasis on providing support for the children and families impacted. Our work as prosecutors also include outreach to school districts, often through and with law enforcement within the schools, serving in the role of school resource officers. In Indiana County, our MDIT and Child Advocacy Center respond to child abuse allegations and work within the community to raise awareness, promote reporting, and connect families to services to address trauma. The number of children who will be victimized are staggering, as at least 1 in 10 children will be sexually abused by their 18th birthday. According to the AUPC statistics between 2019 and 2023, of the statewide child abuse offenses charged, 52% were sexual in nature, 23% endangering the welfare of children, 16% were corruption of minors, and 2% were aggravated assault. Indiana County handled 554 cases in that time period. Child exploitation through the internet, social media, or cell phones is impacting our teens, to say the least. While it is great that our students enjoy the benefits of using technology to connect with friends and family and often watch baseball games across the country, it also subjects them to unwanted manipulative activity designed to gain access to personal information and photos. Intimidation tactics are then directed at victims to transfer funds or credit card information to avoid public exposure of the material exchanged. Frequently, disclosures of abuse are made at school to an adult, teacher, or fellow student. Kids spend a significant amount of time in school-building relationships with their fellow students, teachers, administrators, and staff. Many even enroll in school-based summer learning programs. Responding to reports of child abuse requires sensitivity and a trauma-informed approach. Children are vulnerable victims of abuse because these events often occur behind closed doors and at the hands of trusted family members or adults they know. Investigations have revealed that victims are sometimes threatened and do not report the abuse. Threats to harm the child or beloved family members are a tactic perpetrators use to silence victims. This is why an all-hands-on-deck approach is needed to provide school education to kids of all grades so they know what abuse looks like, how they can safely report it, and why doing so is a critical step in making it stop. House Bill 460 accomplishes these objectives. The PDAA commends the sponsors of the bills for prioritizing the safety of child victims. I want to take a minute to discuss the importance of House Bill 460 mandating child abuse awareness and education programs for students enrolled in cyber charter schools. There have been some tragic incidences of severe abuse suffered by children who are enrolled in public school but learn remotely. If there is abuse going on in the home, these children are not seen on a regular basis by teachers or others in the community who might connect or notice visible signs of injury or neglect. It is especially important that programming be monitored to ensure children are learning the signs of abuse and know how to safely report when they are in this type of alternative learning environment. Providing clear guidance for kids who are experiencing these challenging circumstances must be mindfully inserted in the curriculum being considered by this House bill. Mandated reporter training helps staff understand the harm victims suffer if abuse is happening, recognize the signs of the abuse so they can act and appropriately follow the law by reporting. House Bill 460 increases the time allotted for schools to administer these critical trainings. Prosecutors are key partners in the mission to prevent and respond to child abuse. This is why prosecutors work collaboratively with their MDIT partners and police, including CWAS caseworkers, to identify child physical, sexual, and emotional abuse and hold offenders accountable. The key is to break barriers preventing children from coming forward and provide a safe, systematic reporting process within the public school district or designated charter school. Kids should be supported in every step, including the critical step of coming forward. Children abuse programming for all school-age children as proposed in House Bill 460 is an especially important measure because it will provide children with a clear path to recognize and safely report their abuse or any abuse that they've witnessed or know about. PDAA hopes that our identification of these issues is helpful and welcomes further discussion going forward. Thank you to the sponsors of this bill and the committee for making child abuse awareness and prevention a priority. Thank you.
Thank you for your testimony. I'd like to say that Representative Howard and Rep. McKenzie are in attendance. And next we'll hear from Dr. Levi.
Thank you very much for allowing me to provide some testimony. Thankfully, this is the first time I've been in this building in 15 years where I'm not looking for any money. It's really refreshing. So by training, I'm a pediatrician, a primary care pediatrician. I've been at Hershey for 26 years. I'm a philosopher. I do work in bioethics with a focus on human decision making. And so I approach this issue of child abuse and child protection from a hands-on perspective, but also from a conceptual perspective, looking at some of the underlying issues that make it what is often called a wicked problem, something that is complex, interwoven with lots of other issues, and not easily addressed with a single intervention. The idea behind this House bill is wonderful. The idea of providing education to people to raise awareness, to promote improved behavior is outstanding. In my roles, I have learned the complexities of this. In the aftermath of the Sandusky tragedy scandal, I was tapped to be the founding director for Penn State Center for the Protection of Children. I developed a whole range of system and a whole range of programs that would help address this wicked problem. Chief among them was an educational intervention, because I understood that people need to understand this at a deep level. They need to not only be informed, they need to care. They need to identify, both with the adults anyway, with the vulnerability of the children and with their own responsibility as mandated reporters. The challenge of, and our program has been tested. It's, to my knowledge, the only evidence-based online educational intervention for mandated reporters in the country. We've done studies in Maine and Pennsylvania. They've been NIH sponsored, and the iLookout program, and you have a little one-page handout on it, is the recommended mandated reporter training for Head Start programs in all 50 states and U.S. territories now. one of the things I've learned is that it's really hard to do this well. And so while I entirely applaud the intentions and the goals of this bill, as other speakers have mentioned, the importance of getting this right, doing it well, is of the utmost importance. You know, we all know the saying that a little bit of education, a little bit of knowledge is dangerous. And a lot of things are well intended, but don't reach the desired goals. It is hard to do this well. We've done enormous amounts of research on how to do it well. It turns out there are only 10 states in the country that even have pre-post testing. So people do a mandated reporter training and they don't even check to see if people have learned anything. And when they do, they usually don't use validated questions. And validated questions are important because it turns out if you ask college students, is their professor knowledgeable? Their answer is actually most closely correlated with, do you like your professor? To figure out whether they think their professor is really knowledgeable, you have to ask a better question. So things that seem straightforward are often not. And so I want to echo the comments of the prior speakers that the idea of doing this using people who really understand education, who really understand child abuse, really understand child protection, and really understand implementation programs is crucial. Millions and millions of dollars are spent on this. And it's not clear to me that simply, certainly for mandated reporters, that adding another hour of a training that we don't know whether it's effective is going to make a positive difference. When it comes to children, the issues are even more complex for the reasons mentioned that most teachers are not prepared to address the nuances of this issue. And it's also the case that when you introduce this kind of knowledge to children, it needs to be done very carefully lest you put into effect sort of unexpected consequences. As was mentioned, there's evidence that an educational intervention, that a psychoeducational intervention that involves parents and teachers and second graders is effective. It was published in March of this year. When you look at other interventions aimed at educating students, the ones that are effective are minimally effective at improving knowledge, but they've been shown to make no difference whatsoever in terms of child safety. So I think that if this is going to be done, it needs to be done very carefully. It needs to be evidence-based, right? And there is ongoing research on this. I'm happy to share what we have learned. And I think it's also important to think about where the resources need to go for education, right? It may be mandated reporting, but then the quality of the mandated reporting needs to be better. How do you ensure that people not only learn, but that learning is sustained? What do I care if my learners understand something right after the training, but a week later have forgotten it or don't know how to implement it? Those are issues that have to be taken into account. We know that the people who field these reports of suspected abuse, Childline, are enormously understaffed. They're under-resourced. If we're going to put money into the system, we want to think about where we know it's going to make a positive impact. And the timeline for this makes me worried. The idea that in a year and a half or 2 years, we're going to have a curriculum that is implemented statewide without the appropriate vetting, it strikes me as unwise. I've put together in my written testimony some additional information. If you look at the research that we've done on the iLookout website that we provided links to, you can learn more. But I just want to make it very clear, this is difficult to do. In our program, which I think is arguably the best researched in the country, it's hard to get people to understand basic things. We teach people that bruising, that blue-gray spots that don't change over time, what used to be called Mongolian spots. Before our training, 31% understood that wasn't abuse. Afterwards, 59, nice improvement, but that still leaves 41% who don't understand it, right? So I have lots of information about this, but the bottom line is we don't want to rush into implementing something that we don't know if it will make a positive impact. And as prior speakers have said, this is too important an issue to not address it well. As a pediatrician, I've dealt with both reporting, I've dealt with the long-term consequences. As a researcher, I've looked at these issues, and as someone who's developed educational programs, I know how hard it is to implement this. So I just want to caution that as we move forward, we need to be careful, deliberate, and evidence-based as we move forward. Thank you.
Thank you, Dr. Levy. We now open the floor to questions. Rep. Genst.
Thank you. So what would you suggest to make House Bill 460 better?
You're asking me?
Yes, I am.
All right. I think if you're talking about sexual child abuse, there is a program that exists. And if the goal is to, I mean, we know that Pennsylvania is a bit of an outlier in that the largest percentage of reports of suspected abuse involve child sexual abuse. We have a program. It's evidence-based. Implement that. Implement it in the way that it was done. There are many kinds of child maltreatment, and so painting with one broad brush is not going to be effective. Identify what are the goals that are after. If the goal is primarily sexual child abuse, then implement that program in an evidence-based way with the people who ought to be implementing it. If the goal is broader, define those goals. Is it physical abuse? Help explain to parents what counts as physical abuse. Help explain to children. If you're going to educate children in schools and the goal is to increase disclosure, make sure that we have resources to address those. If we're expecting more reports, make sure that Childline is appropriately staffed. I was just looking at the numbers yesterday that Illinois, which has roughly our population, we have 13.1 million. We have 80 people staffing Childline. In Illinois, it's 150. Michigan, which has 10.1 million people, has 177 people staffing their intake. So define what the goals are and then have a narrowed approach to address those goals.
Thank you very much.
Representative Schlegel.
Thank you, Madam Chair. As important of an issue as this is, I really appreciate that the testifiers, are both written and those who are here with us today, because this is a very important topic, and it's very complicated. And it's something that I think whatever we decide to do moving forward, this isn't something that stops here. It doesn't stop with HB 460. It is something that we are going to need to continue to revisit, revise, and continuing to connect with stakeholders to make sure that the programs are effective and they are making a difference in the lives of children. The other thing, I'll just kind of paint a picture with a broad brush, and I do have a question then. With all the things that we expect our educators to do, it just occurred to me today, looking over the testimony and thinking about all those kinds of things, that the level of intensity of staff development for all our educators in our school is so intense. One needs to come to those sessions on the top of their game, well rested and laser focused on the knowledge base at hand, because it is so very important, and this topic certainly is one of those. I just really want to capture the notion of the level of intensity that we're now at in our school systems with the development of our staff and their knowledge base to be able to do all the things that we want them to do. And yet it doesn't make sense to do so, because those children are with our educators in our schools at least for half of the year, and sometimes during the summer as well. I am curious relative to training. Is there a difference in training for staff that work in brick and mortar schools as opposed to awareness training for teachers, for educators who are involved in cyber school programs?
Thank you for those comments. I want to just say something first, if it's okay, in response to what you just said, Representative, because I think it's very important. when you talk about the intensity of the delivery of these trainings and these programs, I think you're 100% correct. Whoever is delivering it has to be at the top of their game, because these are complex issues where children are involved and teachers are involved. That's why we were recommending that these programs not be delivered by teachers who are not specialists in the complexity of the dynamics of child sexual abuse and the complexity of the results and how it harms children. And in fact, when we have presented all of these different evidence-based and evidence-informed, and I do absolutely agree, when possible, it should be evidence-based, and the program out of Penn State is exactly the one I was referring to in my comments. We get disclosures from children. We get disclosures sometimes from teachers who didn't understand what had happened to them or had happened to children that they are seeing. And so it is very important that those who do the training understand what they're presenting and how to respond to get those children at that time the help that they will need. So I thank you. I agree with those comments. In response to your specific question about the difference in training, children who are being cyber-schooled are not being seen one-on-one as a teacher sees a child in a classroom. So I do believe that there needs to be some type of check-in on students so that they are being seen, whether they're being cyber-schooled or homeschooled, because if there are no eyes on the child, what we know happened during COVID, when children were locked at home, when all of the schooling was being done online, is that reports of child abuse plummeted. And it wasn't because we think there was less abuse, it's because we think that the abuse was not seen and was not being reported. And in fact, I had one story told to me by a kindergarten teacher that she had a horrifying experience, that she was teaching her class virtually, and that there was one child in the classroom she saw with her head down on the table and was kind of stuck, didn't really want to call the child out in front of the other children online, but still wanted to somehow help the child, finally said, Jane, making up that name, "Are you okay? Is everything all right?" And all of a sudden, she saw Jane being yanked out of the screen by an arm and heard Jane's screams in the background. And once again, there are 29 other children there who she does not want to cause further trauma to as well by watching this happen. She herself didn't know what to do. Finally, Jane ended up back in the screen and was crying. This teacher did obviously call 911. She did call mandated reporters. But unless you have that type of a situation where a teacher can actually see what is going on in cyber school or homeschooled, then I don't know that it's necessarily the training, but the eyes on the children. And Dr. Levi, maybe you have a different opinion about the training for that than I do, but that's my take on it.
Well, just specifically to your question, to my knowledge, the required training is the same for all mandated reporters. There are different programs that qualify for different kinds of continuing education credit for teachers versus child care providers versus others. But as a rule, all mandated reporter trainings that are state authorized come through DHS. They vet them very carefully, give them a bunch of feedback to make sure certain things are included. But to my knowledge, every training, even though they're very different, have the same elements.
Thank you.
Thank you. Rep. McKenzie.
Thank you to everyone for bringing up this topic today. I was a teacher in private school and public school, and this was long before, long ago anyway. And I know when I was a teacher of a student at the private school, I noticed that there was something amiss. And I didn't really know what was going on, but I was substituting one day in the preschool, and the little 3-year-old girl, it was after Easter break, and I said, "Oh, what did you all do on Easter vacation?" And then everybody said, "Oh, we went to Grandma's, we got eggs, blah, blah, blah." And then it came to this one little girl, and she said, "Daddy locked Aaron in the closet." And so Aaron was a 4th grader in the school. So we teachers got together and we took it under we didn't know. There wasn't really reporting back then. This was long ago, decades ago. And we handled the situation in our own way. We sent the fourth grade teacher to the home and said, Aaron wasn't doing well, so he needed a little bit of extra tutoring. So that teacher was going to go to that home. And just that acknowledgement of the parents that the teachers were going to be in the home and observing things, the issue went away. So again, that wasn't sexual abuse, that was just, physical abuse or emotional. But I feel that even now, the reporting in the schools is not always, handled properly, even by the designated reporters. But anyway, the sensitivity of this particular area is what concerns me, because I have gone to Mission Kids. I've seen the sensitivity in those people and how they address the child psyche. It's so wonderful that they have that really in-depth professionalism so that they don't frighten the children or, stress them out further after they've undergone enough trauma to that point. So my concern is who is going to do this work? How are we going to make sure that these people are adequately trained, highly sensitive, and not going to create more problems? It's a problem throughout society that children are being attacked day in and day out. But I don't want to have any further trauma put on the children by, pointing out, and this might introduce the concept of sexual abuse to them where they haven't experienced it, and now they're going to be afraid, maybe somebody's going to hurt me someday. So I'm just worried about the who's going to do it and how is it going to be implemented, and I just worry about the children. Thank you.
So if I may, there are two aspects of that. I think that Abby can speak to one of them particularly. One issue is about the sensitivity of how these things are delivered, and I'll defer that to Abby. But I'd make a comment about something you said, which is, I think, right on point, which is that we want to be careful we don't create more problems. Simply increasing the number of reports does not help us, right? We need to decrease the noise so the signal can get through. And that signal to noise ratio is part of the issue, right? We don't report whenever we're in doubt, right? Because the more you know, the more often you're in doubt. A kid who's withdrawn and sullen and not themselves, they might have been abused, but their cat might have died or their grandmother might be in the hospital. We don't know. So we know that it's not the mandated reporter's role to investigate. That's only the state. But by the same token, you need to know something enough to reach this concept of reasonable suspicion, right? So, if you look at the substantiation rates for school employees, for every 100 reports, 5.5 of them are substantiated. Some are better, some are worse, but by and large, we need a system that helps increase the signal and decrease the noise. And again, that's not a straightforward thing to do. In terms of delivery, I would defer to people who provide that kind of delivery to students.
Thank you. I agree that the delivery has to be done by individuals who understand the dynamics of child sexual abuse in particular, if that's what we're talking about, who understand that it needs to be presented in a trauma-informed manner and reacted to in a trauma-informed manner. The National Children's Alliance, there are 40 child advocacy centers in Pennsylvania. The National Children's Alliance is the overriding accreditation body for those 40 centers. One of their optional standards, I think it was introduced 3 years ago, is in prevention education. So if there is a child advocacy center like Mission Kids that is accredited in providing prevention education, they, in my humble opinion, would be ideal professionals to be able to deliver these trainings and these programs. It is also within the ability, I believe, of all of these 40 centers to become accredited in the prevention education standard. Yes, it's the dirty word, money. There needs to be some type of funding for it. As I said to you, the program that was developed by Penn State, somehow the number was come up with at $43 per child to deliver the program. We've been able to get it down to $25 per child. I spoke with the creator of the program, Dr. Jenny Knoll, last week as I was preparing my testimony. She told me and reminded me that in the article that was published in JAMA, that they went back into the schools the following year when the second graders became third graders to see if they retained the information, which is what Ben was alluding to. And indeed, yes, they had retained it. So that's a very good question, Representative McKenzie, and I think that's the answer, whether it's child advocacy professionals, licensed therapists, other professionals that deal with child development and understand the complexities of child's sexual abuse are the individuals who should be delivering it. And also, to your point, to support the teachers as well, because once they leave the classroom, the teachers will have more students who come through, and to help them to understand. Part of this program that was developed at Penn State has not only the 1 hour component to the children in the classroom, but it has 1 hour to parents as well, and I saw that in one of the written comments that was presented. Question of transparency to parents. There's an hour-long component to parents to be given, as well as community education. So that would be my thought. Thank you.
With no further questions, I want to thank all of you for your, oh, I'm sorry. Okay, all right.
I just assumed.
Okay. Chair Klunk.
Thank you, Chairwoman. I do have a couple of questions, and I appreciate you all joining us. And again, I apologize. I just assumed. I do have some questions, and I come at this as a parent. So I have a 7-year-old daughter and a 4-year-old daughter, and trying to equip myself onto how to be a good mom, making sure that my daughters are better prepared than maybe I was, and even my friends, and going to school and living our lives in this world of abuse. So when you talk about the parents having a component of training, how do we reach the parents? Because there are millions of great parents in this world who we need to equip with the tools to educate their children so that they can go out there. Their children are the ones who are equipped, who that then can potentially be almost the reporter themselves. And that's what I've been learning, is that if you equipped your children, you are actually helping not necessarily your own child, but more often than not, the other child in that classroom who is being abused. Because the interaction of your child with the child who's being abused, your child comes home and says, "Hey, Mom, Johnny asked me this." And that's when the mom can go in and say to the teacher, "This is what I heard." And then they can get the support for Johnny. So what are we doing on the parent side? Because I do think there needs to be this parent component. Parents need to understand what is being taught, figuring out how we can support in this effort too. So what does that look like from a parent's perspective on what our children are learning, and how can we as parents not just put this on our educators, but how can we as parents better equip our kids?
I love that. That's perfect, because that's just it. Child abuse can't be stopped just by teachers, and that's the idea of this safe and healthy communities. When it was first introduced, I'm a member of the Child Advocacy Center Advisory Committee at PCCD, and I remember when Dr. Knoll introduced this project to the committee, because the committee was the decision maker on whether or not to provide Endowment Act funding for the project. And the words that she used that stuck with me all these years later is that it is a braiding project, so that it was braiding together, teaching children while teaching their parents, while teaching the community. The idea being that if you got 5% of a community trained, that you can then change the tide of child sexual abuse. So part of this evidence-based program that Pennsylvania took the horrors of Sandusky and turned into this amazing cutting-edge evidence-based program is to train the children, the parents, and the community. The training in particular to the parents, if that's your question, that looks like having parents understand, like their children do, but from an adult level, what child abuse may look like, what the red flags might look like. As Dr. Levi said, a Mongolian spot does not represent a black and blue mark in child abuse. A child being absent from school may not represent child abuse, but if you have a child who is absent from school, whose grades suddenly plummet, if they're an older child, they go from being the honor roll to suddenly failing. Or exactly the opposite, a child that's just been kind of whatever they're doing suddenly is hyper-focused. All of these taken together with other signs and symptoms might be red flags of abuse. And so it's also training to understand, if you think that you're seeing something, it's not, you don't have to define it. You don't have to prove your case as a prosecutor is, but that's when you call Childline and report it with the flags. It's understanding that it's understanding the red flags to abuse, the signs and symptoms, and then what to do, I guess, is the best answer I can give you. Does that answer in specifics enough? Is it too general?
So then how is, again, we don't have the requirement in Pennsylvania that this is, in our schools and part of the curriculum. So right now, without this bill, how can we as parents, what are the resources that are out there for parents who want to be good parents? So we know what is age appropriate for my 4-year-old versus my 7-year-old versus parents out there who have a 14-year-old. Where is that information so that we can better equip parents? Because as a parent, I'm looking on Instagram trying to follow somebody who's a child psychologist, and where is that information for parents?
Okay. Look for your child advocacy center. 40 counties out of the 67 have a child advocacy center. Go to their website. Most of those will have resources in the community. Look at the state chapter website. It's penncac.org, PENNCAC.org. That will tell you if your county has a child advocacy center, and it will tell you other resources as well. Please contact me directly at Mission Kids. I don't mean to make this a commercial, but we provide prevention education training to children, parents, and communities. We go outside of Montgomery County to do it as well. Also on our website, missionkidcac.org, it's information about child abuse, what you can see as a parent, what you should look for as a parent as well. And of course, if you have any questions about what you see, please feel free to contact me directly. There's also a good training program for parents and community without doing the braiding project. It's called Darkness to Light. It is also, it's certainly evidence-informed. I'm not sure if it's evidence-based. I believe that it is also evidence-based. And it's more than 1 hour. I believe that it's a 3-hour program. It can be done virtually. That is an excellent program that I would recommend for parents to go to as well.
Thank you. And I know some of our local school districts have implemented this without, a mandate from legislation, which is, it's great to hear that we have school districts across the state that are taking this to heart and really trying to equip our parents and our children. I did want to make sure that members do see in our testimony that was submitted was a letter from the Principals Association. Our educators, they have a lot on their plate. We try to cram a lot into a school year. So, adding one more thing could be difficult, based on their testimony. They're, I think, willing to have the conversation, which I think is great, and it's great that we're here having the conversation. I did have a question about homeschool parents, and I know we brought up cyber and in brick and mortar schools. For homeschool parents, again, your recommendation: reach out to the local child advocacy center, but with this particular legislation, they are not included. So what would you recommend for those homeschool parents? And could that potentially be made available through the curriculum that would be made available through this for brick and mortars and charters?
Sure. My children were not homeschooled, so I don't have the personal experience with it or cyberschooled. And I don't know the nuances of being able to have your child cyberschooled or homeschooled. But absent extraordinary circumstances, I can't understand why, for some kind of a training like this, a child and parent, even if they're homeschooled or cyberschooled, can't be mandated to come into the community for some kind of a training. Yes, I'm sure there might be some extraordinary exceptions to that. But by and large, and then this way, as Representative McKenzie said, there can be some eyes on the parents and on the child, even however briefly. And this way, as a community, we know that the training that we believe is necessary and appropriate is reaching these children and their parents as well.
And then one final question, if I may. So I know both of you had mentioned second grade. I'm going to have a second grader next year. So why second grade? Is that a particular moment of development where kids are reachable, that they're retaining the information? Why second grade?
Dr. Levi might be able to tell you the specifics of it, but I can tell you that from our perspective, child sexual abuse happens to children of all ages, and it happens when they're young. And we need to educate them when they are young. Sometimes by second grade, it's already too late. They've already been abused. But at least then if they hear the program and they get it, we can then provide them with help, and everybody can go on to have a very healthy and happy life. But the earlier, the better, frankly.
And my guess is, I only have read Jenny Knowles' study, but my guess is that it was just a pragmatic decision. You're looking for kids who can absorb and retain information, that they're able to process things, and they have more attention span. So my guess is it was just a pragmatic decision as a time. I see that the bill here mentions K through 12, and I don't think there's any problem with going earlier. The question is about content, about delivery, about retention. And I guess I would just stress one of the things we've done with the iLookout, which by the way is available free of charge 24/7 online, is that we have an advanced training that uses what's called spaced practice and spaced retrieval, which is best practices for adult education. The idea that you remember something, and most of us, as it turns out, within 10 days, you forget 40 to 60% of what you've learned. And so the idea is that you go back and you ask people to remember this and practice it, to practice applying it. And so I think that programs, they need to be longitudinal. A single hit it may make some difference, but it probably won't make much of a lasting difference.
Thank you very much. Thank you, Madam Chair.
Thank you. I want to thank all of you for your testimony, and thank you, Chair Klunk. I'd like to bring up Representative Mary Jo Daley to speak on her bill. Just said those two, and I didn't realize it was you. So that's okay. That's my apologies.
I would just like to thank Chair McNeil for for holding this hearing. I wasn't able to be here for most of it because I had my own committee meeting, but looking forward to following up and just seeing where your committee is afterwards. But as you know, House Bill 460 would require each school entity to develop an age-appropriate child abuse awareness and prevention education program, incorporating the program into the school entity's existing curriculum for students in kindergarten through grade 12. The model curriculum would be established by the Pennsylvania Department of Education in consultation with the Department of Human Services. For nearly 2 decades, Jenna Quinn has shared her story of surviving child sexual abuse and used it to promote the need for schools to adopt age-appropriate curriculums on child abuse. In 2009, the Texas legislature passed Jenna's law, which requires school districts to educate students, teachers, and parents on child abuse awareness and prevention. Since then, over half of the states have enacted laws modeled after this legislation. Under Pennsylvania's Public School Code of 1949, teachers and other school employees are required to receive training on child abuse recognition and reporting to bring Pennsylvania in line with other Jenna's law states. House Bill 460 would amend this statute to include similar training for students, and the legislation talks about it from kindergarten through the end of high school. So I really do appreciate you having a hearing. I'm looking at the clock, and we're probably supposed to be on the floor, but I really do appreciate you giving this an ear.
Thank you, Representative Daly. Are there any questions? Rep. Schlegel?
Not necessarily a question, unless the representative would care to respond. I just would, again, like to reiterate that this important topic, and I might add that it also, it's just occurred to me that it's true of every single important education topic, and what I know what topic in education isn't important. It really needs to have an ongoing conversation, ongoing follow-up, ongoing action to make sure that what we are doing with our students and how we're training our staff is really simply working. A possible suggestion, maybe an amendment and maybe a discussion at a different time with House Bill 460 and the instruction on age-appropriate child abuse awareness. It might be something that we would require homeschool parents to have access to that type of training and information moving forward. So thank you very much.
Thank you for those comments. I actually made a note for myself that homeschool kids, inviting them to attend the training, but I thought that was a really good point. And I'm happy to just chat with any of the members of the committee if you have questions or suggestions, because we like to, I think it's an important topic, and I really appreciate how you talked about everything we're teaching our kids is an important topic. So I'm glad that you included this in that. Appreciate that.
Thank you. And if I may, I just want to make the point that I was not insinuating that there's any group of folks that are out there that are sexual predators. I just think it's something that we want to have this conversation on an ongoing basis and continuing to upgrade and figure out where do we need to go next. So thank you.
So one last thing, if you'd be willing, want to talk about that outside of this room, be happy to do that with you.
Thank you. Chair Klunk, do you have any closing remarks? With that, we are adjourned. I want to thank Rep. Daly for presenting your bill and the testifiers. We are adjourned.